Greetings of the day. This is Dr. Rratnesh in the community medicine section. Today I'll be talking about the levels of prevention and the natural history of disease. So first we'll start with the natural history of disease. What is natural history of disease? There are two things. As I've already talked of earlier, pre-pathogenic phase and pathogenic phase. What is this pre-pathogenic phase and what is this pathogenic phase? Pre-pathogenic phase is the phase where the interaction between your agent, host, and the environment have not taken place. Though these agent, environment, and host may be present, but they are not to an extent that they may cause disease. So this is known as your pre-pathogenic phase. And the pathogenic phase is one where interaction has taken place and clinical manifestation begins to occur. Now, what does this natural history of disease says? The natural history of disease says how a disease progresses from its pre-pathogenic phase to the pathogenic phase if it is left uninterrupted. For example, if there is an interaction between the agent, host, and environment. For example, if I take example of measles, for that matter, if I take an example of coronavirus, if the pre-pathogenic phase is over, when agent, environment, and host have interacted, and there has been a clinical manifestation. So what happens in the clinical manifestation? Two things happen. In cases of acute diseases like coronavirus, either it recovers or it finds an death. Now, there are other diseases where if they are left uninterrupted, for example, if I talk about non-communicable diseases, so they eventually do not land up with the death. They at times end up with recovery, or there are chronicity. Chronicity would land up into the disability, and this disability at times may lead to death. So the importance is that if everybody, for example, somebody has a measles, so at times if it is uninterrupted, then the patient does not suffer anything. Otherwise, there are cases where you have respiratory complications, and there are times when it becomes complicated, then it gets death. So the natural history of disease becomes very important because we need to understand where you need to stop. There comes the role of your levels of prevention and modes of intervention. What are the different levels of prevention? What are the different levels of prevention? There are 4 different levels of prevention. The first one is primordial level of prevention. The second is the primary level of prevention. Second is the secondary level of prevention. And the last is your tertiary level of prevention. Now, what is this primordial level of prevention? First of all, we need to understand when you need to have different level of prevention. There are 2 things. The first is when you actually have an environment and agent interacting. When you do not have an agent or causal factor, when you do not have an agent and causal factor, though you may have an environment, when you do not have an agent and causal factor, and then when you apply intervention. What is intervention? Intervention means some strategical measures where you put an end to the progression of disease, whatever it may be. Either it is initiation of disease or it is progression of disease when the agent and causal factors are not present in the environment, and at that time when you take the measures, they are known as primordial level of prevention. Primary, when you have agents or the causal factors present, but you do not have, I do not have clinical manifestation. It is there. Here you do not have clinical manifestation, or here at the secondary level you have the clinical manifestations in form of sign and symptoms, and there you take the level, when there you put an end or stop the progression, then it is known as the secondary level of prevention. Tertiary, when it has crossed even the clinical manifestation and it has ended into the chronicity, and chronicity is such that you cannot revert back to the original position. So there you talk about the quality of life. So there you talk about the tertiary level of prevention. Now, what is the primordial level of prevention? The primordial level of prevention talks about the socio-economic and behavioral condition. Let me cite an example. For example, where you will talk about the primordial level of prevention. The primordial level of prevention, I'll talk, supposingly you have a kid at your home and you teach them the good habits of hand washing, you teach them what is good for their health, that junk food is bad for them, then at this level of prevention is known as primordial level of prevention. Example for primary level of prevention is this. Primary level of prevention, somebody is supposedly smoking and he does not have any symptoms of COPD, or for that matter he doesn't have cancer, then you tap him at that position and try to ask him to stop or quit smoking. This is known as your primary level of prevention, because there are causal factors which are present and you're trying to stop at that moment. This is known as your primary level of prevention. What is this? A secondary level of prevention. The secondary level of prevention comes to a site where you have, for example, somebody has a malarial fever or somebody has typhoid fever or something or the other, and he shows the symptom. There you go and have a proper diagnosis of them. This is known as tertiary level of secondary level of prevention. At the tertiary level of prevention, I talk about somebody had, for example, somebody had polio, and then it affected his limbs. Now this limbs cannot be reverted back to its original position. He has the proper problem in his limb, so you provide him with calipers or something or the other, so that he can have an improved quality of life. This is known as your tertiary level of prevention. Now, when we talk about the causal factors, at what stage, sometimes the question comes, what stage you talk about? The first stage I talk about at a very early stage, where there are only socio-economic or the behavioral condition. And at the primary level of prevention, we talk about the specific causal factors. Where stage of disease, where you talk about what? Causal factors. You talk about the causal factors. And at the secondary level of prevention, I talk about, this is the early stage of disease. This is causal factor, and this is early stage of disease. And this is late stage of disease. So early stage of disease comes at the level of secondary level of prevention. It does not come at the level of primary level of prevention. It comes at the secondary level of prevention. So what is the action to be taken at the primordial level? The action to be taken at the primordial level is action to be taken at this level is you stop the socio-economic condition or behavioral condition here. And at the level of primary level of prevention, what do you do at the primary level of prevention? At the primary level of prevention, we talk about there are strategies. There are two strategies we talk about. Here is the population strategy and the high risk strategy. Here you talk about the population strategy and high risk strategy. So this is where you talk about the high risk strategy, and this is and the target. What do I do here? I talk about the health promotion here. I talk about basically about the health promotion. Now, what is the health promotion consist of? The health promotion is nothing else but enabling live people to control over all the factors which determine the health. Factors and determinants of health. So, factor which determine and the determinants of the health, you need to take control over it. There are two things are very important here in health promotion. It is the Jakarta Declaration and Ottawa Charter. So both of these, Ottawa Charter and Jakarta Declaration, are with health promotion. What does health promotion consist of? There is a mnemonic which I have made. It's for be easy for you. Hence life. Now, what does this hence life stands for? The hence life stands for your health education, environmental sanitation, nutrition, supplementation, and lifestyle management. This is where we talk about in the cases of, when I'm talking about, this is all basically in cases of health promotion. So when I'm telling the child to how to brush the teeth, how to wash hands, all these things, they are under health education and coming under the primordial level of prevention. But the point is, you did not have any agent or any causal factor at that point of time, though the environment could have been there. Now, when I talk about your primary level of prevention, I said there are two strategies. One is the population strategy and the high risk strategy. The population strategy is one where you have the entire population, where I have the entire population. So, for example, you are taking blood pressure of the entire population or serum cholesterol level of the entire population, where entire population is being involved. It is known as population strategy. And second is the high risk strategy. High risk strategy are basically with the high risk population or the high risk disease which are being targeted. This is known as your high risk strategies. There are certain habits which forms they are known as to type about the high risk strategies. Now, when we come about we talk about the primary level of prevention. When I have said we talk about the specific causal factors, the mode of intervention here again will be to an extent will be your health promotion is also here. Also you have a health promotion, but you have which is known as specific protection. Now specific protection would involve the things like, first will be your immunization, second will be your chemoprophylaxis, you could have nutritional supplementation, then you could talk about the diseases which are related to your occupation. So what does there are questions which ask which level of prevention. For example, they will ask you question giving a BCG dose would mean the intervention at which place. The giving a BCG dose would mean a specific protection and would come under your primary level of prevention. For example, the first chemoprophylaxis, for example, albendazole is being given to do away with your worms in, and most of the time anemia mukt bharat, this campaign is being run because these worms cause anemia. This is again this is chemoprophylaxis. Then for example, you give iron folic acid tablets to stop anemia in pregnant female. This is again an example of specific protection. Again, putting iodine in the salt is an example of specific protection. Then occupation, for example, you provide a comfort zone to the your workers. This would come under your specific protection. So something which is involving, which you did not had any disease, but you're giving in order to protect them from disease. This is known as specific protection, and this come under your which level of prevention? This comes under your primary level of prevention. Now we talk about the secondary level of prevention. The secondary level of prevention, what do you do and what are the actions? The action is to stop the progress of disease when the clinical manifestation, and what you do here is you do an early diagnosis and the treatment. The early diagnosis, all the national health programs are running at two places. They're working at two basic levels. They're working either at the primary level or the secondary level, and now to some extent they are trying to work at the level of primordial level. But basically they work at two level of prevention, that is primary level, because you all the nutritional supplementation program, all the these program, they will come under your the primary level of prevention. Your immunization comes under your primary level of prevention. So this is what all you have a national health programs which are running here. Now the secondary level of prevention, this is again you have national, for example, they provide kit. Then you have multi-purpose workers taking thick and thin slides. What this is for early diagnosis of your malaria, they take thick and thin. Then you have rapid diagnostic kits in various rapid diagnostic kits which are available. So these are all coming under where? Here under the secondary. The fever depots, the fever depots, the fever depots in the cases of they've been planned at some places. This will come under which level of prevention? They are again coming under the secondary level of prevention. Then you have VCTC center, ICTC. Now you have ICT, integrated counseling and training centers. What does it come? There again, this is basically with ICTC, integrated counseling and training center. This is with HIV, people living with HIV, and you have tuberculosis. They club together, and here you have centers where for better sentinel surveillance. So you have ICT centers. If you have ICT centers, you have two options. One is this for a secondary level center, and this is also for your sentinel surveillance also. When I talk about sentinel surveillance, I'll talk there. Now the tertiary level of prevention. What does this tertiary level of prevention? When the disease has progressed and you have a bodily and structural change or something where your quality of life is being compromised. So what you do, you improve on the quality of life. You improve on the quality of life. That means you work on disability limitation. You work on the disability limitation. I've already talked about disability in my one chapter of disability. So what do? You do rehabilitation. Now rehabilitation is training and retraining the person to to an extent where he can have highest level of functional ability. So rehabilitation could be of medical rehabilitation. You could have social rehabilitation. You could have psychological and you have vocational. So rehabilitation is of four types: medical, social, psychological, and vocational. What does medical means? Providing with things which can help him out. For example, providing calipers, providing Jaipuri foods. So providing Jaipuri foods would come where? It will come under tertiary level of prevention, under the medical rehabilitation this is going to come. So whatever the question, you need to understand that. Then social interaction, for example, wherever you have social stigmata, for example in the cases of leprosy where people have the social stigmata, you work on the level of removing the social stigmata. This is again the level of tertiary level of prevention. Psychologically, self-esteem, providing that I do not suffer from anything. If I am suffering, I'm not suffering at the level of mental. That means I'm improving my self-esteem. If self-esteem is being improved, this is your psychological level of prevention. Vocational means providing livelihood. So if you talk about reservations for the compromised people, the government is already providing for disabled and compromised people a certain level of reservation. This reservation would again come under rehabilitation and would come under your tertiary level of prevention. Now we have already talked about here, and in the context of natural history of disease, and I say pre-pathogenic phase and the pathogenic phase. The pre-pathogenic phase and the pathogenic phase. When I say pre-pathogenic phase, pre-pathogenic and pathogenic. So here you have, because interaction is beginning, so there is only primary level of prevention. Okay. At the pathogenic phase, because this is going to progress to an extent, so you have two other levels, that is secondary and tertiary. So when I say disease beginning from pre-pathogenic to pathogenic phase, you have only three levels of prevention: the primary, secondary, and tertiary level of prevention. Although there are four levels of prevention for any context, so you should be able to answer the questions. I believe in all these contexts, your level of prevention and to these things. So thank you. Hope you understood. And if you want, you can put your comments under your comment box. Thank you.